Hello, my name is Dan Cheever. As the United States Northern Command J5, it is my honor to introduce this video about the Women, Peace, and Security Program and its impact on U.S. military support of COVID-19 response operations here at home and working with our partner nations abroad. I have been fortunate in my military career to have been mentored by female military leaders, and personally, by my #1 hero and role model, my mother. Growing up, I watched her serve as president of the League of Women Voters, executive secretary at Argonne National Laboratories, and as mayor of our hometown for well over a decade. She showed me the power of diversity and the meaning of opportunity and freedom. Currently in her 90s, we are working to keep her safe from COVID-19. COVID-19 presents unique challenges and amplifies existing vulnerabilities faced by diverse populations in the U.S. and around the world. Women and girls are disproportionately affected by this global pandemic. We must ensure we include their leadership, perspectives, and experiences in our collective response. Just like combat operations, women play a critical role in our military COVID-19 response. In fact, women make up 70% of the global health force and comprise a large portion of our military medical roles as well. In this video, you will hear a range of perspectives and experiences from U.S. military institutions about our COVID-19 response and the key roles played by our diverse force. Thank you for your service. Thank you for watching, and thank you for supporting the Women, Peace, and Security Program to ensure security, freedom, and equality for all.
Global conflict is evolving, and the need to identify sustainable security approaches that meet the unique needs of an entire population is greater than ever. As our adversaries and competitors continue to seek strategic advantages, we must work together to continue to empower and train diverse talent. Advancing the U.S. strategy on women, peace, and security provides a unique engagement opportunity to strengthen our relationships with allies and partners through collective efforts to reinforce women's empowerment, meaningful participation in decision-making, protection from violence, and access to resources. DoD recently launched its Women, Peace, and Security Strategic Framework and Implementation Plan in support of the strategy. This document outlines how the entire department will work towards fully incorporating the perspectives of women in military activities, operations, and investments across the continuum of conflict and crisis. The global COVID-19 pandemic provides a concrete example of the growing complexity of international crises. In a situation where DoD is providing critical assistance to allies and partners around the globe in a time of acute need, we must consider the impact of this crisis on the entire population, including women and girls, to fully address it.
When you look at why is it relevant to have women involved in security more broadly, it's so key because women, again, they represent 50% of the population, but they also have qualities that the population recognizes. And those are trustworthiness and credibility. And so when you have women at every level, the population looks at the institution as more credible and trustworthy. And that is critical for success of any institution. So if you're a minister of defense, if you're a minister of security, you want your institution to be successful. You want it to be credible. You want it to be trustworthy. Having women at the core makes that happen.
Interestingly enough, the National Civil Protection School leadership had actually said that they were very proud of the fact that over 55% of their local community leaders that they had trained through their civil school were actually women. And I found that interesting, not only because of the statement it made, but it also, what he said after that, he said, we have gotten more information from the local community leaders in our communities in Mexico, because we have women leaders who are very much in touch with the communities and how they can help their communities prepare for disaster responses. And that was just telling in and of itself.
Our females were, more likely than our males to sometimes show emotion within the home. But I think that was a learning opportunity for everybody to understand that we all deal with trauma, we all deal with loss, and it's okay. It's okay to say that this job is hard. It's okay to say, the veteran that we just sat with for the last 6-8 hours, the veteran I cared for yesterday or last week who's no longer here, to identify that as a loss, to make meaning of that, and to honor that legacy of that individual, both within this home and within their family, their community, and their legacy as a service member and veteran. I think diversity within our ranks is extremely important. It allows us diversity of thought, diversity of background, of experience, and being able to see individuals who look like us or from the same part of the country as us or have similar backgrounds or experiences show us that we can aspire to be whatever we want, that we can encourage others in the ranks beside, below, and above us to take advantage of opportunities that are presented to them, to become a leader in whatever field they choose and to succeed in those capacities. I think every individual as a human being has capacity and has competency, and sometimes we just need some encouragement to develop that.
I've always been exposed to strong women leaders, but seeing them really step up to the forefront of this response was heartwarming to see, and they really were the right people to do it. And I think the thing that was interesting about that was they were such strong but compassionate personalities that they were excited about each patient that got on and off the comfort and was able to return home and was healed. And they were really they applauded every single time we were able to get more patients into the center and out of the center, because it meant that we were caring for more people. And I think that's a unique thing that women were able to bring to that, which was that they're very strong, making sure we're getting things done and getting those numbers where we needed to get the numbers to make sure that we were helping the community, but then also just to applaud each person that was going through. And so it was very interesting to see the female roles that were there. And it was really great. There was really no conflict between all of these different agencies coming together and the men and women working together. And that's a testament to the military and how we've come a long way, that women leaders are not shocking. But the compassion that women, I think in this instance, brought forward was a necessary feature to make sure that leadership was solid.
From my perspective, I think having gender diversity, one, is always a good thing, but especially in COVID operations, when there's a lot of things that would affect typically single parents, such as how they would get childcare if they do need to go to the hospital and they have no one that can watch their child. We had several instances when people would show up to our military treatment sites, our ships and our field hospitals, and they had a child that they were sick, but the parent was sick and the child wasn't, and we weren't sure how to treat that. So some of the females on the team, we really looked at these and made plans for these in terms of a gender lens that maybe our male counterparts didn't have. And because most of our office, they all are men with stay-at-home moms that, they didn't really have to kind of think of these things. And so I think we were able to open their eyes and bring some of those different perspectives to our planning and operations.
Another gender aspect that has been playing during this COVID pandemic has been the mortality rate, which in Guatemala has been similar to other countries, with men dying at a rate of 3 to 4 times more than women. In Guatemala, a single homes led by women already made 25% of the population in a very male-dominated society. So with the COVID-19 and mortality rates for males, this is leaving even more women who depend on their male partners for support to be left now on their own, vulnerable, with no means of support. They're having to go into trying to find jobs to support their families. And that just makes them more susceptible to be out in the street with the virus out there. They have more exposure for themselves and their children, and they're also exposed to more human trafficking and gender-based violence.
We're seeing that women and other vulnerable groups are being hit the hardest from the coronavirus pandemic. There's been an increase in domestic violence and sex trafficking from lockdown orders, and this has put a stress on women not only because of their role as primary caregivers, in many situations, but also because many of them are in frontline healthcare worker responsibilities in their work lives. And this has created a situation in which there's a disproportionate exposure to women, not only because of the economic and social factors, but also because of their roles in frontline care.
Integrating gender perspectives means understanding how gender-based differences shape the needs and the outcomes of men, women, boys, and girls. Now more than ever, the COVID response at home and abroad has amplified the need for integrating gender perspectives to minimize strategic and operational blind spots, but also to maximize mission effectiveness. And by the way, it's not a women's issue only, it really is everyone's issue, because it is about considering the entire spectrum of human capital and human security. We're certainly on the right path, but we still have a lot of work to do. We must continue the conversation. We must ensure that women are part of the decision-making process. The good news is that we have tools and resources such as training and gender advisors like me who can assist every member in the Department of Defense on how to integrate gender perspectives in everything we do, including this pandemic response.
Women and girls in Guatemala face different forms of insecurity, and COVID-19 has come to amplify those issues. Guatemala already has high rates of femicide, and domestic violence has tripled during this period. Women in normal times face insecurity, job discrimination, workplace harassment. And now with COVID-19, a lot of women that have gig jobs have been dismissed, and now they're out there in the streets begging for food, basic items like beans and milk, to sustain their family. Women, being out there in the streets make them even more vulnerable to the pandemic, the virus, exploitation, targeting by criminal groups, and even gender violence.
As we are more data-driven, as technology advances constantly, you really need people that have diversity of thought in solving problems that are more complex, come at you quicker, and if you can build a team, every person leads differently, every person follows differently, but if you can build a team that is diverse, you're going to be more successful in solving those really difficult issues. Sometimes when you're in a position where you might be one person that doesn't look like the others, it actually gives you an opportunity to really imprint your own leadership style and be able to help others see a perspective they wouldn't normally have the opportunity to see.
A lot of your women in the military are caregivers, and during this disaster, during this COVID response, we've had kids stay at home, we've had to take care of elderly, and so women have had to take their role as caregivers in their family with their role in the military and have to be able to balance all of that. So I think short-term solutions like teleworking and shift work and considering liberal leave for women now, and if we can expand that short term to the long term to start looking at things that the military can do to help women at that mid-career point when they're starting to raise families and and starting to think about the rest of their life and the rest of their military career. If we can start taking those things that we're doing now and apply those, then I think we have a better chance of being able to retain women in the military. And then when they get to the senior ranks, we will have a greater percentage of women.
Every time you put on the uniform and walk out the door, not knowing when you're going to be able to return home, that's challenging for your spouse, your kids, and your family members, because they want to know that you're safe, and you're trying to offer that reassurance, whether you're safe or not, because you want them to be reassured and not be worried and not be stressing themselves out when the situation is already stressful enough. Since I've joined the military, we've been at war for like 19 of the 20 years I've been in the military, right? And so this is not new, but it's new in that it's this pandemic. It's where we live. It's in our communities, right? It's not going across the water to some foreign place and being there for a certain amount of time. You can put a physical barrier up to prevent or to mitigate like combat risk, but it's different when it's just interactions are the risk, right? And so that isolation and that social constriction of what you can do is impactful.
So these overwhelming numbers of sick people have put a large stress on a lot of women who not only have responsibilities for their family, but also are primary frontline healthcare workers.
I think first and foremost, we need to be aware and actually capture the data of what kind of gender makeup and diversity makeup we have. Figure out what our team dynamics are and who might need to work a different shift. Maybe they can't work the night shift because it's impossible for them to get a sitter at night. And try to be more sensitive to those types of differences and try to come up with ways to resolve some of the issues that single parents or females in particular might encounter.
Promoting diversity and gender perspectives within our partner nation militaries allows us to, in the long term, advance U.S. national security interests as well.
When it stops being the first woman, the third woman, the fifth woman, when it really becomes basically unremarkable that a woman has moved into a senior position regardless of the field, that's when we'll know that really we have reached true equality.
Each individual person that we were bringing onto the Comfort was a unique story, a unique person. And as you were getting overwhelmed by the numbers and seeing the overwhelming numbers throughout the world of people who are being impacted by the COVID-19 response, it was really helpful to know that each person that you saw, the name of them, and each person that we moved on to the Comfort from one of the hospitals in New York City, you were helping that person and you gave that person another chance to fight and that person a chance to get well.